In a bid to eradicate hepatitis, the chairman, Senate Committee on Health, Dr. Ibrahim Oloriegbe says efforts are in place to draft and pass bill for the establishment of National Agency for the Control of Hepatitis. Oloriegbe disclosed this during the 2020 Mike Omotosho annual lecture themed Achieving Zero Hepatitis in Abuja, adding that 5 health committees in the Senate and House of Representatives had earlier formulated the legislative health agenda as regards an innovative approach to set the direction for legislative contribution to healthcare reform in the country.
As Ninth Assembly, when we resumed, we were privileged to be appointed as chairman of Health Committee. The National Assembly where chambers, the Senate and the House of Rep. In the Senate, we have 2 committees that focuses on health sector. My own is Health Committee, Secondary Tertiary, and then we have a committee on primary healthcare and communicable diseases. In the House of Rep, we have committee on health services, health institutions, and HIV, AIDS, and TB. I have the privilege to be the co-chair, overall overriding chair, what we call the chair of the chairman for all these 5 committees. And when we came in August, we held a strategic retreat, the first of its kind, to formulate the legislative health agenda as regard an innovative approach to ensure setting the direction to contribution to healthcare reform in Nigeria. This is an important step to achieving synergy and setting goal and teamwork towards achievement of universal health coverage, which will impact on achieving hepatitis zero.
For his part, the organizer of the event, Dr. Mike Omotosho, reiterated the commitment of his NGO towards raising more awareness on hepatitis with the aim of halting its spread and eradication from the society. He also stressed the need for government, NGOs and the media to enlighten the public on the need for screening, treatment and management of the viral disease.
Just 10 years to the United Nations SDGs Target 3.3, which aims to eliminate deadly diseases, particularly hepatitis. How prepared are we as a nation with just 10 years to 2030? Screen 50,000 people for hepatitis. Screen 50,000 people for hepatitis C, with the help of Rotarians, of course. And after that, I decided we can't stop there. This must continue. So, to churches, to mosques, corporate entities, to organizations. We even started a clinic in my, and we're hoping there's a lot of other things, but without prejudicing the discussions today, I want to leave it open to that. Please relax, enjoy the show. But one thing is certain. We do have about 27 million people walking around with the virus in Nigeria out of almost 500 million people globally. Worse still, only 5 million of those people are aware of their status, leaving about 22 million people walking around infecting others and ready to infect others. What are we going to do about that?
Highlights of the events was the unveiling and presentation of the book Achieving Zero Hepatitis, World's Smallest Book on Hepatitis, recognition awards given to 7 organizations, non-inclusive, and act by a comedian.